All right. So welcome everybody. Welcome Dr. Dev. This is our third Genomics Gupshup session. Sorry, we started with a little bit of technical difficulties, but Dr. से मिलना है तो थोड़ा late तो होना ही है. So let's start off. I think today we are drinking this interesting tea chosen by Dr. Dev called turmeric ginger tea. That hopefully you are enjoying.
Yeah, it is. I'm enjoying it. Yeah.
So Dr. Dev, why did you become a doctor?
So I think growing up, I think my parents have always told me their whole point was that you are going to be a doctor. Like I have an elder brother, they just clearly just told me that okay, he's an engineer, you are a doctor. So I don't think that I've ever thought that I would choose any other profession other than doctor. I grew up with that whole thought. I never had any other idea. Like if somebody asked me like what would you I thought I would become other than doctor. I don't have any clue. Like it has always been that and that has been my aim. Thankfully, I landed up into this, so it's a dream come true for everybody in the family and me. So yeah, that's my story.
That's awesome. Yeah. So what do you think? I mean, you come and join Mapmygenome, and clearly we are not. I mean, we are in healthcare, but we are not necessarily write prescriptions. So, what are you thinking in terms of when you wanted to join us, join our team? What were your thoughts, and maybe also throw some light on what you think where the future is going to be, and from a medical profession.
For sure, yeah. So I think working in hospital is, of course, is way more different than what we do here. I think what we're looking at over there is solution to a problem. Here, what we're looking at is how to, we're like working in an aspect we're trying to prevent the problem. So that becomes which is again the best thing to do right now, at least for ages to come forward, because we know what happened with COVID. We all were trying so hard to prevent it as much as possible. And then I think most part of India, or let's say like major part of the world is currently alive because of the precautions we take. So clearly it's an example that precaution is better than cure anyway. So coming here, I just learned, I think genomics, I mean, even if I open my textbook, genomics would be that 2 pages chapter, which will just speak to you about, okay, this exists. But then coming here, I just really I couldn't even believe the amount of information which is there in your DNA and how do we process it here, and the amount of ways we can help people, it's commendable. So I think that has been really amazing. Coming to the future of medicine, clearly this looks like a future of medicine because, I mean, I think if you asked me like 2 years ago, do you know the concept of pharmacogenomics? If at all we're looking at it, like we are just popping pills. Like everybody, I take a pill. Like I have a headache, I take a pill. Like antibiotics run like it's some kind of a chewing gum. People just take it these days. But are they actually working for you? I mean, you're constantly taking those, and they're not working for you. When it comes to antibiotics, there's a lot of resistance. Lots of people just take it like. When it comes to my parents take antibiotics for every single thing. Although as a doctor, I tell them like, no, you're not supposed to take them, then they'll stop working. But no, for them, it's just like, that's the only thing. But then, if we reach into a point where we can actually understand what would work for me, what would not work for me, it will obviously make my life so much easier and it will save me a lot of money as well. So I think what we're doing here is obviously the personalization. I'm pretty sure that it's going to be future. At the same time, being proactive about your own health and making sure that you're making proactive choices for health is obviously a good way to do. Yeah.
So you've also started doing counseling for a lot of the
Yeah.
And at least the feedback that I heard was that people are thoroughly enjoying the session.
Okay.
Which is, I think it is quite an interesting thing because you didn't come from a genetics background, you came from a medical background. So I think what makes you excited about this process of counseling and when you are talking to these patients? Why is it, or not patients, I would say I call them customers.
Yeah.
Right? What is it that you found interesting, and what is your secret sauce?
There's no secret sauce, but I think, like in a hospital setting, maybe you might not spend so much time with your client trying to understand their problems or whatever issues they have in a larger aspect. If somebody comes with me a headache, I'll only talk about headache. I will not talk to him about your heart health and everything. Now we are trying to talk about a holistic point of view with respect to health. And also, they feel they are heard. I think the whole point of counseling is that they feel they are heard. We are not just trying to tell you that you have this problem, you take this solution. we are actually trying to help them understand what all they can do with respect to their lifestyle changes. I think irrespective, no matter how much we talk to them about their solution part, I would just be like, okay, fine, this feels nice. Like, I'll take this tablet, I'll be fine tomorrow. Then on a longer run, it just feels so good that somebody's actually telling you that you have to do this, you have to do that, do this. For a longer period of time, that obviously is something which I have learned here. At the same time, I think it just feels nice. I'm trying to, whenever like some client, whenever it says that, okay, now I'm going to start doing this, that feels really good. That they're actually going to consciously make these decisions so that they would be healthy or it would help better them in some way. So that obviously feels nice. Yeah.
So you think that all the doctors will eventually get genetics, or most doctors, or some doctors?
I think they should.
Yeah.
Honestly, they should. I think that should play a major role. Like we're only looking at like disease as a disease, but we're not looking at the back end part of it, like what led it to that and what we can do to prevent that. But if at all, if somebody has an idea of this can happen to you, this you are at risk for, then obviously my whole ideology would change about how I can make it not happen. Yeah. So I think.
So genetics can give you a lot of information, right? It
Yeah.
can help you understand predisposition to disease, but it can help you understand what drugs are working for you and so on. So from a clinician's perspective, which part of genetics, there's, at least I like to classify this as like curiosity, customer, and then clinical. Which part do you think that doctors would be most interested in from your perspective, at least having interacted with others,
Yeah.
not as you as an individual, but where do you think that, where do you feel that medical professionals will find most benefit and will start prescribing genetic tests?
I think as such, like when we're talking about, like as a clinician, I think pharmacogenomics any day, because we all want to know what to help people get better. So if you're actually going to prescribe the medications, I think it's better to prescribe something which would actually work for them. Instead of them having to go through so many painful procedures and all of that, if we know that this is going to work for them, this might not work for them. So I think it makes it easier for both clinician and the patient so that they're making the right choices. At the same time, I think next to that would be what we do, Genomepatri, the health risk and all of that. It obviously is going to help as a clinician also to understand what all factors I have to take into consideration so that I can make choices or I can make decisions with respect to treatment as well. That this would work, but then what if he's at risk because of this medication? Let's say if I'm giving him medication, let's say psoriasis or anything, if I'm supposed to give him immunosuppressant or anything, which have a lot of, they're very harmful for your kidneys. They have high amount of kidney failure cases which would happen because of it. But if at all I know that he's at risk for kidney problems right before, then my mind would work differently. Then I would try to choose drugs or even medications which would not affect them at that level. So that will obviously help me make a better plan for it. Yeah.
So Medicamap and then
Genomepatri, yes.
But also, I guess the exome sequencing.
Yeah, for sure. Now, those I think, yeah.
The medical, when you're looking at it, trying to find, also, I guess, in some ways, looking at treatment options.
Yeah.
And finding the root cause of the problem.
That's true, yeah.
So we found like a lot of the neurologists, for instance, find that exciting because I think sometimes they're not able to find the solution to the problem. So, one of the products that you've been working on, which we haven't yet fully launched, is a product called Genomic.
Yeah.
So, what is there in that product? What have you found exciting in terms of what we can do and how we can help people in that?
So, of course, like Beauty Map here is what you're working on is, of course, to do with skin. Now, we are going to talk about various aspects of, again, like considering skin as supposed to be not just an organ of beauty, it also shows reflects of how your insides are. It talks about your health and various conditions, like for everything. Be it your, let's say your skin condition again basically depends on your vitamin levels and your antioxidants, and what you take shows a lot of it shows on your skin. So I think having a balanced diet. So we'll be talking about the product will be talking about your vitamin levels and your antioxidant capacities And also we are going to talk about your aging, which again is to do with your skin glycation and hydration. Skin glycation is again to do with your sugars. I mean, let's say somebody needs to consume a lot of sugars, then there is a high chance that there's going to be increased, let's say, like early onset of skin aging, because sugars create some kind of bond with your collagen and they would destroy that. We will be talking about that. We will also help them understand their chances of aging, tanning, and also we'll be doing about sunburns. And then I think we'll also be going to do about male partner imbalance, alopecia, acne, which is I think which would benefit a lot of them because that is one of the serious problem with be it teenagers or everybody people deal with on a major level. But then if somebody who knows that they are at risk, of course we will always give them all the suggestions and advices they can do to maybe control them. So giving them that kind of information will always be helpful. So we'll be doing that. And also the cancers, psoriasis, atopic dermatitis, which I think is something which people need to be aware of, at least making people aware and understandable that these are some risks which are there, these can happen. At least that'll help them plan their routine better. If that is something somebody is worried about, let's say premature graying, which is one of the aspects which we work for, we can always include it with the biochemical tests, which will help us understand probably because they have deficiency of certain vitamins which are causing it. So again, which will help us backtrack it and also maybe just find it at the earlier place where we can just make interventions which will obviously be helpful for a longer time.
So you believe that putting genetic information with the biochemistry information is the most valuable?
It obviously is. Yeah.
So I think all of you who are watching, I think make sure don't eat so many jalebis. The skin will start looking better.
Yeah.
Not just jalebi, all anything that is sugar.
But anything in moderation.
Moderation is fine. I think occasionally you can have, but don't make that your dinner and lunch and breakfast.
Yeah.
So beauty is not just then skin nutrition.
Not at all. Yeah.
So it is also shows a lot of the health in terms of your own internal health as well.
Yes.
So a lot of that is visible on our skin.
Okay.
So let's go back to, you mentioned biochemistry.
Yeah.
Let's go back to when we look at Genomepatri, we are now adding on a basic health check. So how does that help you in, how does it help a consumer understand where they are in terms of their health? How is that putting those two pieces together? How is that?
So I think whenever the report actually says about conditions which these people are at risk for. So at the end of the counseling session, obviously we provide them with the recommendations of tests which they have to do both. So I think that basically gives us an idea of what conditions they are at risk for. Like irrespective, I think it is always advised that people start getting an annual health checkup done even for women or men after the age of 35 and 40. So that it gives you it gives us an idea of where we are heading towards. Like if you find some problematic areas well and early, it's better to make an intervention. I think when we're going to include genomics and biochemical aspect, I mean, like if I ask you to get your lipid profile done every year, you would be like, why? I just got it done last year, it was normal, why would I continue it? Probably you just do it for another 2 years and you'll stop it. But then given if I tell you that yes, you are at risk for coronary artery disease, probably genetically, and you have family history, probably you would do it once a year. You would start making sure that you've been doing it regularly because you know that you are at risk for it. Instead of just like getting tests done just because some doctor had told you to get done, probably helping them understand that we are asking you to get this test done because you might be at risk for it. So I think that will help people understand that they will probably like take it seriously, maybe take their health seriously, not just the report. We don't want to scare them with the report, of course, but then at least help them understand that this is something you need to concentrate on, or like just this has to be your health plan. Yeah.
Yeah, I mean, I've actually maintained a spreadsheet from 2001 onwards.
Okay.
Where I put all my blood parameters. So you can actually come check my whole listing.
Sure.
I think it's valuable information.
Yeah.
Trends, whether it's going up or down.
Yeah.
And I think for me, it has also been helpful because I found out that I'm at risk for diabetes. Therefore, I think HbA1c I do every 3 months. It's the same thing. I think now if you put it up in a place where people can see what is happening, I think it really helps them understand the present and also what might lie in the future.
Yeah.
So, what else do you think? Where do you think you mentioned that the world of medicine is going to be personalized and it's going to be in the future. How long and what effort will it take for us to get, let's say, 30% of the doctors educated about this? Can we make some way of getting this done if it is not done at the curriculum level? Like you mentioned, it's only 2 pages of genetics, whereas I think genetics is going to be where large number of drugs are now personalized, large number of medication are now personalized. Do you think other than the curriculum change, is there any way we can have medical doctors to?
And it's all about getting them, I think it's all about to do with awareness, because as a medical student, nobody ever told me that while I was in my medical college. I'm pretty sure when I speak to them also about something like this exists, I mean, a major part of them actually are actually shocked and surprised to say that, okay, that actually happened. We always read it in books that this happens, but knowing that it actually happens is something which would be let's say that'll be that'll be something as a revelation for them. That'll be a revelation for people. I think what we're doing here, at least people should have an idea that this can actually be done. So that should be a start. At the same time, of course, because Human Genome Project actually started 20 years back, and our books are, of course, they're being refined, published, and everything. But still, there is need for this to be a major part of it, so that people actually understand this. There is a lot of genetic correlation to whatever is happening.
So I guess making it in a simple way that will be easily digestible by people, both in terms of consumers but also for medical professionals.
True. Yeah.
Is an important element. All right. So any of you have questions?
Dr. Dev, thank you very much. It's a wonderful topic. So you told about 2 things. One is about biochemical test as well as the genomic test offering to the beauty map.
Yeah.
So biochemical tests like your HbA1c levels or your vitamin levels, all of them will tell you about what is the health condition. In terms of genomic level, what are you screening, so that you can tell that to correlate both of them to get a beauty map actual product.
Okay. So I think, let's say now since we're talking about biochemical tests, as I've said about vitamins, how they play a major role. Now again, I think that amounts to a major part of it, because when it comes to even your collagen production and be it your, let's say even your cell turnover, whatever, which is basically very important for your skin to be maintaining a healthy condition. Even your wound healing capacity, even your scars and everything. So that is again very much dependent on your vitamin levels. I think screening for vitamin levels is obviously going to help you with that, so that if you are taking adequate amount of nutrient, vitamins, and let's say even water for that matter, your skin is going to clear out, which I think everybody knows that drinking lots of water is always beneficial. Now again, people spend a lot of money trying to get so many cosmetic procedures, like tons of money. Cosmetology industry is like $1 billion industry right now. But then what is the point if you don't start from within? So I think this will obviously be a point where we can work on. Tomorrow, if somebody tells me that you are at risk for skin aging, why don't you just get your levels checked? Why do you get a genetic test done? Let's say we're talking about skin hydration, glycation, and your aging here. If somebody told me that, okay, you will start getting aged by the age of 30, then I wouldn't want to look 40 when I'm 30 for sure. So I think getting these tests will obviously make me have like a better plan, be it my diet, and if at all somebody is actually looking for some kind of help, then dermatologist can always provide it. If it's not something which can do at G level. So yeah.
So if I take care of it, I look like at 25 and I'm 75.
You already look like 25.
I'm not yet 75.
So today it was nice talking to you. And I have one question to you. You said the biochemical test and the genomics test can go hand in hand. So in that case, take for example, a person is having diabetic for 35 years or something like that. So in that case, those people will be, if I give a genomic test, so that person will be scared to look at the report.
Yeah.
So what kind of suggestion as a doctor or a prescription you would suggest them to go for it? Because already they are diabetic. They want to go for genomic test. They are doing a genomic test. And the biochemical test also like it was saying. So both have been handed how it will help them in the age after certain age.
Okay, so now let's say like earlier there was also a blog which was written about diabetic care in our this thing. So we are talking that almost 40% people are actually undiagnosed with diabetes. They would land up finding a complication. Maybe now we are talking about people who are undiagnosed, who have undiagnosed diabetes for years together. They finally land up in complications. So that is one part. So here, like, let's say if that person were to take this test at some point in their time, let's say this person is 50-year-old and he directly landed up to an ICU with some DK or diabetic ketoacidosis. If this person were to familiarize with this idea that maybe he could get a genomic test done, let's say at least 30, then we are actually telling him, let's say he's at risk for diabetes or he has a family history of diabetes. We are telling him to get a HbA1c done 3 years. Or let's say that person, maybe he might not get it for 3 years, like 3 months, at least he'll get it once a year. So let's say that way we could actually would have actually helped him. At some point he's getting his HbA1c levels so that we would actually stop him from getting landed up in this complications. That could be one aspect. Let's say the person is already diagnosed and he's not able to get any help, and he's getting these Genomepatri and also your biochemical test done. Again, now Genomepatri, when it comes to diabetes, we are not just talking about HbA1c or the type of diabetes. We're also talking about associated factors, be it your diabetic retinopathy or your kidney failure or your liver problems or our associated diabetic problems.
Also like cardiovascular.
Yeah, also the cardiovascular problems, which all go hand in hand. So if the person is there for like 25 to 30 years and he's still dealing with diabetes, either the medication which we are giving is not working for him, or either it is not being diagnosed properly, because now diabetes is not type 1, type 2. There are several types. There are almost like 4 types. Now I think, yeah, like the variants, yes. And just doing HbA1c is not going to give us an idea of what type of diabetes it is. There's again an extensive panel which I think we will be coming about. There will be talking about where we can actually differentiate the type of diabetes they are having. So I think that would help clinicians, of course, this make a better, medication choices or anything. So even if the drugs which we are working, so maybe it's simpler. Like I think one instance you shared is your mother, where she's diabetic and she was on medication, it wasn't working for her, and then she changed her medicine. I think that could be an example of what we can do.
Yeah. So once she was diagnosed, she was in Rajasthan. So we found out that she was given metformin, and my dad had taken metformin all his life, but for her it didn't work. And when I looked at her report, it showed that. So we went to the doctor, showed her that, and then she changed the medication, and she was fine. I think no, it was change of medication.
Metformin.
Yeah, we changed metformin completely, and it was fine. So I think it's cases like that, right? I mean, how do you make sure that people understand that sometimes it is based on your genetic makeup, you might just not respond well to a particular drug, right? Whether it is in terms of understanding itself, both in terms of efficacy, but also toxicity for that person. So, any other questions?
So that was my experience also, like.
What's that?
Yeah, because like previously when I was working in other organizations, like I also had the same experience like that. But for most of the Indian people are like poor metabolism.
Change with the dosage of it.
Yeah, dosage, and even some people, as you said, like they're resistant to that drug also. So that is one thing. And one more thing is like how far this is acceptable in doctor's community. That's the toughest question.
I think we had a meeting with one of the hospitals where we had seen that there is a little bit of controversial gray area. I think some of them are really welcome to the idea. Some of them are like, okay, no, I don't think that's not how it works. But then we are not completely going to tell you that, okay, this medicine is never going to work for you. We're just going to only tell you about that. There is a chance that this might not work for you. I think we're just playing around that gray area. But again, like if it works for them, then that's great. But then if it doesn't work, but we're actually giving them a choice and understanding that, okay, maybe it didn't work for you because genetically you are not at, in that effective area. So I think that is still a gray area. I think we should get to there sometime.
Yeah, and most of the doctors prefer to give medicine on their means like their own. But a patient comes with this medical map or genomics report saying like this drug is not poor metabolism. So in that case, like how the doctor reaction would be?
Most doctors are familiar that sometimes the drug works.
Yeah, now in past 5 years, most of the doctors are accepting that. Before like this, older community, like people who are more experienced people, they are not ready to accept these kind of things.
I mean, even
And
if
you have to show them the data, and I think most
Exactly.
doctors would accept. Is my, at least I tell you what, at least one of the doctors that told me once, he said, if you can make it cost effective, what, I know that it doesn't work for 30% of my patients, but I'm just doing a trial and error. And that is one of the main drivers why we said let's reduce the cost. And because initially when we started, we added, the cost was 25,000. Today it's like around between 5 and 6,000 most of the tests are. So I think that's the difference. They said if you get it down to a reasonable level, I'm happy to prescribe it. But I don't want to be 10 times the cost of the medication itself. Right? I think that probably is another factor when medical doctors are thinking about it.
I think maybe if I would not join this company, some people have given this report, I'm just like, okay, what? No, keep that away, I'll just write what I know. So yeah.
I have a comment to make. I don't know whether it's a question or not, because since we are discussing about it, try this one. So basically, that's what doctors believe in evidence. Actually, unfortunately, evidence is coming in this decade. It's like 3-4 years, the evidence are coming. People are writing more and more publications. And second thing, the reason might be because I think this clopidogrel, warfarin, or morphine, this is a million dollar corporate business. If you don't prescribe that one, if the doctor don't prescribe that one, if you write a different drug which is not that much popular in the communities, doctor communities, you tell them that this is not going to work with you, this other thing will work with you, doctor will not accept it.
But
How
I
many
think if it
doctors
doesn't
will?
work, I think there is, in the end,
Yeah.
the doctor is trying to treat you, right? So
That's the reason they say that this evidence is not
Actually,
sufficient for me.
There is
Though
not
it's a evidence
much.
that there's a reason to not accept the evidence, saying that this evidence is not enough.
But I think
So
that
you
is
have to make evidence stronger and stronger day by day.
But I think that is when patient's role also come into play, right? If he thinks that the medication is not working for him, I think it becomes patient's responsibility to put forward that this is not working for me. What do we do about it?
Exactly.
Yeah.
So you have to make the patient
Yeah.
aware about it. No matter what doctor tells, he should be able to put his friend out.
That's
Because Indian mentality are like you just go to doctor. And if he tells something
So
that he
does
is
everybody
good.
There, I guess. Yeah. When it comes to medical perspective, I think, yeah.
Okay. So, you guys have any questions?
Right. Currently, premature white hair is the most common problem facing by the youngsters. Even I am facing it.
Yeah.
So, what does genetics say about it?
So of course we have that panel where we talk about premature graying. But again, there's so many factors which are related to it, be it your vitamin deficiency or your genetic inheritance. Now see, inheritance is something, if you have any inheriting like premature gray hair without any reason, although your levels are normal, everything is normal. The only thing which you can do is just diet. That can be the only this thing, or you just have to come in terms with it. There's nothing much you can do. And I think gray hair, I think people shouldn't be worried about it. It's fine. These days, you can paint your hair any color you want. Yeah, right. I don't think it should be a point where people should be considerate about it. I mean, people are turning pink gray.
Yeah.
Exactly. So I think that should be a way to go. You are lucky. You don't have to go to the other phase of bleaching and everything. So that would be one thing. But if your levels are something which you can be helpful for you, getting a biochemical test is obviously something where you can start with. And also just checking up with your dermatologist on what all options you have. Right? Yeah.
So talking about the beauty map,
Yeah.
you wanted to become a dermatologist, we heard that.
Yeah.
So how do you define beauty for girls, for women who want to take that beauty map and look at that features, whatever we are getting, that conditions, they might be analyzing it in a different way. Before we go into it, how do you define beauty?
But why did you say only women? Why can't men do it?
True. Yeah.
Yes, I should have done that.
Beauty and handsome.
Beauty, the point about beauty, like why do, again, like coming to you, but like beauty people are obviously considered to be a male thing, female thing, but I think let's just generalize it, I understand that. But yeah, I mean, since you're asking, I want to understand like what, again, your question was.
Like, before we get into that beauty map, how do you define beauty? Looking at that condition, so I don't want to get upset with me at that condition if I go with the beauty map. So before going into that, how do we explain beauty?
Okay.
So,
Yeah. So I think beauty is about perception first of all, and I think it has nothing to do with how you look on the outer side. I think we need to completely understand the fact that we all are made different. There is nothing as conventional beauty. Conventional beauty standards are complete bullshit, if I can say. But yeah, I think you need to be. I think people need to also understand that. I mean, your 5 fingers are not the same. I mean, how many other you have? They're not the same. And I think it has to do a lot with your inner beauty, whatever. I think that should count. A happy person, I think a happy mind and healthy body and happy mind is the most beautiful thing which is. And healthy mind, I think any day, these should be I think what beauty should be. But I think like coming to beauty map we are doing, again, we're not going to talk about like, let's say how sharp your nose will be, how chiseled your jaw is going to be and everything. We're only talking about your health conditions like be your vitamins or your something which would actually be beneficial in your aspect of your health. We're not going to talk about, just I want my whatever, like my skin, like I mean, we're not talking about how Botox would work for you or things like that, right? I mean, that would be something which should be extreme. We're not trying to change the person, we're only trying to make the person feel better.
so holistic view of beauty, that you're making sure that you understand that the things you can do which will enhance your beauty. Starting with a smile, like I said, you're happy to show your face. But I think there are other things. I think you mentioned a lot of the conditions,
Yeah.
like skin aging and all of that, which ultimately I think are what you eat, what you drink, what you know.
Yeah.
So I think that makes a difference.
True.
Okay, so go ahead.
Yeah, I mean, yeah, that's it.
So any other thoughts that you have that you'd like to share, which I might not have touched upon?
Pretty much. I think the other interesting thing which I think we are working about is the drug-drug interactions.
absolutely.
Yeah. So I think so. This is something I think we're still working on it. But yeah, I mean, we will be working on how two drugs would interact with each other. Let's say the person has to be on like multiple drugs, how they would work with each other, and how would that affect the person genomically. I think that would be something would be really helpful also for people because I think every time like somebody has like a list of pills for COVID, like whenever like people ask me, we just sent out like 10, 12 medications
Everybody
or whatever
gets the same
prescription. Yeah, same medication. And the first question was like, can I just take them together? I think so now that just always puts everybody in a loop that can we take this together? Is there something which is going to be, happening if I take them together? But I think what we are trying to do here is to just give them an idea that okay, if at all you take this medication together, there's a risk for this. So I think that will also make it easier both for clinician and also for the client, whoever is on these medications. So I think that is something we're going to be working on. So that's great.
So taking two drugs, can you give any example of then two drugs? Might not work for it, like, so one is obviously, I think sometimes most doctors will know when you don't take two drugs.
Yeah,
right?
yeah.
Which I think medically everyone knows, or at least
Yeah,
ones who know.
yeah.
But there is also the aspect of drug in presence of a genotype.
Yeah.
That might not work. And then I wanted to also bring up one more thing that there's also the drug food interaction.
Yeah, true. So I think we're going to be like grapefruit juice, which is I think this is going to interact with so many medications. Grapefruit is one of those medications which is there like once if somebody wants to check back onto it, grapefruit juice has interaction with so many medications that is going to alter its dosage or its mechanism. At the same time, when it comes to drug-drug interactions, there are so many drugs, I think. So what happens is these drugs work on, let's say, these combination of enzymes. So one works as an inhibitor, one works as a structure. One would enhance its activity, one would decrease its activity. So now genomically, we're trying to understand how this interaction will work along with already pre-existing their genetic activity with respect to the drug. I'm not able to recollect names because there's vast amount which we've been working on. So yeah, I think that is something which should obviously be helpful. So yeah.
Any other questions?
So to add up actually for the value reactions, like if you take serotonin reuptake inhibitors, SSRs, along with some antibiotics, it has a drug toxicity levels. So that that information might help to You can always switch the antibiotics. There are lots of options nowadays with the ones which suitable for SSR. All this stuff.
Yeah, yeah. That's what we're doing.
So that's great. I think if nobody else has any question, I don't have anything else to discuss. I think maybe this was, I think, a fantastic session. We have had a great interaction, I think, and of course we had technical issues. It was not that you made us wait, so I wanted to clarify that.
Great things will not come easy.
But thank you for this wonderful session, and we are very glad to have you as part of our team, and I think you continue to give us inspiration in many different forms. So with that, I think I would like to close this session of Genomics Gupshup. Please do join us, and if you haven't yet subscribed, what is the thing they say? Please subscribe.
Click the bell icon.
Click the bell icon in all of them. So thanks again, and hope to see you again soon.